Hi, a recent viewer just recently asked us, what are the common questions that they should be asking when they go to the rhinoplasty consult? What do we think is important for them to understand?
That's a really important question. To start with, they need to get an idea of the surgeon's qualifications. What's his or her particular background, their expertise, their board certification. But when you're talking about something like rhinoplasty, which is a complicated procedure, that's really just a starting off point.
Totally agree. I think that rhinoplasty is a creme de la creme procedure in plastic surgery. So it's really important to know that it's focused for that practice. In our own practice, we generally tell patients it's about 80% of the work we do. So the sheer volume, you want to know how many cases a year that do they do, how often they're having to revise their own work, and do they do revision work at all? Moreover, you want to find out what do they do if they do have to do a revision. A lot of surgeons will charge you extra fees if they have to go back. So those are questions that are important.
And more specifically, when you're interested in rhinoplasty, you really want to get a sense of what that surgeon's particular experience is with noses like yours. There's really a huge difference. People of various ethnic backgrounds, skin thicknesses, and your own particular aesthetic. You may find some surgeons tend to favor a particular look in their rhinoplasties. Our own particular bias is that we're looking to make sure that we individualize the procedure to each patient and that we're not projecting our own aesthetic onto that result.
Yeah, that's really, really important when you're talking about the different ethnicities. It's really important to know and look at their book or their computer images to get a sense of what is the frequency of cases that they're doing with these different ethnic groups and different faces and different skin types, because if the particular surgeon is usually doing only one type of surgery, then you may not be a good candidate for them. So that's the place where you can start to ask some of the technical questions. Do they do open versus closed rhinoplasty? How do they approach breathing issues? Are they comfortable dealing with breathing issues? A lot of general plastic surgeons may not necessarily do septoplasty, so those are things that you want to understand.
So you want to see a lot of before and after results from that surgeon with patients who look similar to you in terms of what they're looking for. And then you want to have them do some computer imaging to really give you a very clear sense of what the goals are and make sure that you're both on the same page. You understand exactly what's going to be accomplished. And at the end of the consultation, you should be very comfortable with all the questions you've had being answered. They should give you adequate time to really do that. So if you're not comfortable, or if there are some residual questions, by all means, make another appointment and go back in to see the surgeons before you decide on proceeding.
Yeah, that's a key point. If the surgeon's not comfortable sitting and explaining and answering your questions before surgery, it's very unlikely that you're going to be happy with the answers that they're going to give you after surgery. So that's an important part of the whole process. We really think that computer imaging is a big part of the communication avenue that you have between you and the surgeon. So make sure those things are all done.